All right, go for it. Yeah.
Okay, I, Carlos Gomez, give Student Health 101 at Santa Clara University permission to use this video.
Go for it.
Hi everyone, I'm Carlos Gomez. I'm a recent alumnus of Santa Clara University with a degree in public health and a minor in biology. Currently, I'm the assistant resident director for the sci-fi community, and I'm also doing research with Dr. Saxon on stress.
Hey Carlos, thank you for sitting down with us. I was wondering if you could tell us a little bit about your opinion of smoking on campus.
Sure. Well, personally, I think smoking is a choice, but I think those who decide that to smoke should be cognizant of how it affects others. In a community like Santa Clara, we're all pretty close-knit. It's a pretty close-knit community. People are in close contact with each other, and so I think it's important for people to know how it affects others, especially I'm talking about secondhand smoke. As a public health major student, I read a lot in my classes and heard a lot about the effects of secondhand smoke and how it takes a toll on people's health. And so personally, I choose not to smoke, but when I pass by others who are smoking, it's as if I'm being forced to smoke. And so that basically makes me somewhat bothered by secondhand smoke.
What have you done on campus to make your opinion more well known?
Well, starting towards the end of my junior year, I joined Dr. Saxon and Dr. Stevens on a project to start conducting some surveys and gather student opinions on smoking on campus and see what students want to do about it. Our current smoking policy was rated as not effective and was given a D- by the California Youth Advocacy Network. And so I feel like when students hear that, it shocks them to know that Santa Clara University isn't already a smoke-free campus. And so we started this with a couple of other students, and then my senior year we continued the project, and eventually I was a student health and safety senator for Associated Student Government. And so through that I voiced my opinion in ASG, and we were able to gather a lot of public health science students to jump on this project, and we submitted a report to the planning committee and the faculty senate, and basically stating our opinions. So that's what we did. We were proactive about the approach, and we believe that it was our responsibility to not only voice our opinion, but maybe the opinions of other students as well for our own health.
What did the data gathered from other students show about opinions of smoking on campus?
Well, when we did the survey, we asked students what they felt, if they felt that were bothered by secondhand smoke, and a good 75% of students that took the survey, and we were talking about 1,300 students that we surveyed, they mentioned that secondhand smoke was something that they were exposed to at least daily, if not weekly, and 77% said that they were actually bothered somewhat by secondhand smoke. That being said, it's stating that maybe something should be done about it when at least 77% of the student population is bothered by secondhand smoke. We also asked them if they thought the current policy was effective or ineffective, and a good 85% of them said that it was somewhat effective or ineffective.
What are some changes to the on-campus policies that students would like to see based on your findings?
When we asked the students what they would want to see, 71% of the students said that they would favor having designated areas, and that's because a lot of times that we were asking people, they thought they kept in mind those who actually smoked, because they're also members of our community, and a good 58% said that they would support going smoke-free, just like other universities have.
All right, well, thank you very much.
No problem.